The Sunshine Paradox. Dr. Lena Hansen's exploration into the double-edged sword of vitamin D drive. Lena Hansen, an endocrinologist renowned for her work on bone metabolism, had long championed the crucial role of vitamin D in human health. She routinely advised patients on the importance of adequate vitamin D levels for bone strength, immune function, and overall well-being. However, she also recognized a growing trend: the increasing popularity of high-dose vitamin D supplementation, sometimes exceeding recommended levels. One afternoon, a patient named Mr. David Chen came to Dr. Hansen with complaints of nausea, weakness, and frequent urination. His blood tests revealed surprisingly high levels of vitamin D. Upon further questioning, Dr. Hansen learned that Mr. Chen, aiming for optimal health, had been taking a significantly higher dose of vitamin D supplements than advised. "It seems there's a misconception that more vitamin D is always better," Dr. Hansen mused, realizing the need for a more nuanced understanding of its potential downsides. This case sparked her interest in conducting a comprehensive study on the side effects of excessive vitamin D intake. The vital role of vitamin D, more than just bone. Before we delve into the potential adverse effects, it's crucial to acknowledge the indispensable functions of vitamin D in the body. Often referred to as the sunshine vitamin, because our skin can synthesize it upon exposure to sunlight, vitamin D also comes from certain foods and supplements. Its primary role is in regulating calcium and phosphate absorption, which is essential for maintaining healthy bones and teeth. However, vitamin D's influence extends far beyond skeletal health. It's involved in immune function, modulating immune responses; cell growth, influencing cell proliferation and differentiation; neuromuscular function, contributing to muscle strength and coordination; reducing inflammation, playing a role in inflammatory processes. The active form of vitamin D, calcitriol, acts like a hormone, binding to vitamin D receptors present in various tissues throughout the body. The shadow side, exploring the potential adverse effects of vitamin D overload. While essential, vitamin D, being a fat-soluble vitamin, can accumulate in the body, and excessive intake can lead to a condition known as vitamin D toxicity or hypervitaminosis D. This is generally not caused by excessive sun exposure because the body has mechanisms to limit vitamin D production from sunlight. Toxicity typically arises from the overconsumption of high-dose supplements. Mechanisms of vitamin D toxicity. The primary consequence of excessive vitamin D is hypercalcemia, an elevated level of calcium in the blood. Vitamin D promotes calcium absorption from the intestines, and when levels are too high, this absorption becomes excessive. Hypercalcemia can lead to a cascade of adverse effects, including gastrointestinal issues, nausea, vomiting, poor appetite, constipation, weakness and fatigue, general malaise and muscle weakness, frequent urination and thirst, due to the kidneys trying to excrete excess calcium, kidney problems, calcium deposits in the kidneys, nephrocalcinosis, kidney stones, and even kidney failure. Bone pain. Paradoxically, while vitamin D is crucial for bone health, very high levels can sometimes lead to bone pain. Neurological symptoms: confusion, irritability, cardiovascular issues. In severe cases, hypercalcemia can affect the heart. Dr. Hansen's research design, investigating the dose-response relationship of vitamin D to systematically study the side effects of vitamin D. Dr. Hansen and her team designed a comprehensive research plan, literature review, a thorough examination of existing scientific literature on vitamin D supplementation and toxicity, including clinical trials, case reports, and observational studies. Retrospective data analysis, analyzing medical records of patients with high vitamin D levels to identify common symptoms and associated health outcomes. Prospective study, conducting a controlled study where participants are given varying doses of vitamin D supplements, within and exceeding recommended limits, and are monitored for changes in blood calcium levels, kidney function, and reported symptoms. Findings from the literature review. The literature review highlighted that vitamin D toxicity is relatively rare but can occur, particularly with very high doses, often above 10,000 U per day, taken over extended periods. It also indicated variability in individual susceptibility to the effects of high vitamin D levels. Findings from the retrospective data analysis. The analysis of patient records corroborated the link between high vitamin D levels and hypocalcemia, as well as the associated symptoms like nausea, fatigue, and kidney issues. It also suggested that individuals with pre-existing kidney problems might be more vulnerable to the adverse effects of high vitamin D. Findings from the prospective study. The prospective study, while ongoing, had preliminary findings suggesting a dose-dependent increase in blood calcium levels with higher vitamin D supplementation. Some participants receiving very high doses showed mild symptoms consistent with hypocalcemia. The spectrum of vitamin D levels: deficiency, sufficiency, and toxicity. Drive. Hanson's research emphasized the importance of maintaining vitamin D levels within a healthy range, avoiding both deficiency and excess. Deficiency can lead to rickets in children, osteomalacia in adults, softening of the bones, increased risk of falls and fractures, and potentially other health issues. Sufficiency levels generally considered adequate for bone health and other functions. Toxicity occurs at very high levels and can lead to the adverse effects we've discussed. The optimal range for vitamin D blood levels, measured as 25-hydroxyvitamin D, is a subject of some debate among experts, but generally falls between 20 and 50 nanograms per milliliter, nanogram per milliliter. Levels above 100 nanograms per milliliter are often considered potentially harmful. Factors influencing individual responses. Drive. Hanson's work also touched upon factors that can influence how individuals respond to vitamin D supplementation, including age. Older adults might have different needs and responses. Kidney function. Impaired kidney function can affect vitamin D metabolism and calcium regulation. Other medical conditions. Certain conditions might increase susceptibility to side effects. Genetic variations. Individual genetic differences can influence vitamin D metabolism. The more is better misconception. Addressing misinformation. Drive. Hanson became increasingly concerned about the widespread belief that high doses of vitamin D offer significant additional health benefits beyond achieving sufficiency, without a corresponding increase in risks being adequately communicated. Her research aimed to provide clear, evidence-based information to counter this misconception and highlight the potential for harm with excessive intake. The role of healthcare professionals. Drive. Hanson stressed the importance of consulting healthcare professionals for guidance on vitamin D supplementation. They can assess individual needs based on factors like sun exposure, diet, and underlying health conditions, and recommend appropriate doses. Beyond hypocalcemia, other potential concerns. While hypocalcemia is the primary concern with vitamin D toxicity, Dr. Hanson's comprehensive study also explored other potential, though less common, adverse effects reported in the literature. Increased risk of certain cancers. Some studies have suggested a U-shaped curve, where both low and very high vitamin D levels might be associated with an increased risk of certain cancers, although this is still under investigation. Cardiovascular events. Some research has hinted at a possible link between very high doses of vitamin D and an increased risk of cardiovascular events in certain populations, but the evidence is not conclusive. Dr. Hanson emphasized that more research is needed to fully understand these potential associations and that the primary established risk of high vitamin D intake remains hypocalcemia and its consequences. Translating science into safe practices. Drive. Hanson and her team developed guidelines for safe vitamin D supplementation based on their research and the existing scientific consensus. These guidelines emphasized getting vitamin D primarily through sensible sun exposure and a balanced diet. Using supplements when necessary, particularly for individuals at risk of deficiency. Adhering to recommended daily allowances, RDAs, and tolerable upper intake levels, ULs, unless specifically advised otherwise by a healthcare professional. Regular monitoring of vitamin D levels for those taking high-dose supplements. If you are considering taking vitamin D supplements, especially in high doses, please discuss it with your doctor to ensure it's appropriate and safe for you. The story concludes, Mr. Chen's recovery and a lesson in moderation. Upon Dr. Hansen's advice, Mr. Chen discontinued his high-dose vitamin D supplements. Gradually, his symptoms subsided, and his blood calcium levels returned to normal. His experience underscored the critical point that even beneficial nutrients need to be taken in appropriate amounts, and the more is better approach can sometimes be detrimental. Dr. Hansen's detailed scientific study illuminated the potential side effects of excessive vitamin D intake, primarily driven by hypercalcemia. It reinforced the importance of maintaining vitamin D levels within a healthy range through a balanced approach of sun exposure, diet, and judicious supplementation under medical guidance.